First reading, Senate File Number 3813, an act relating to health. Pursuant to Article 4, Section 19 of the Constitution of the State of Minnesota, Winkler moves that the rule therein be suspended and an urgency be declared, and that the rules of the House be so far suspended so that Senate File Number 3813 be given its second and third readings and be placed upon its final passage.
I call upon the member from Hennepin, Representative Winkler, to explain the motion.
Madam Speaker and members, as we're all well aware, we have a COVID-19 outbreak, and we need to make sure that we are passing along funds to the Minnesota Department of Health for a rapid response. We've been in consultation with Representative Dowd and Representative Drazkowski, the Minnesota Senate, and the administration, and we're prepared to move this bill forward today and have it on the governor's desk before the end of the day. And I would ask you to vote green on the motion, or vote yes.
The member from Isanti, Representative Dowd.
Thank you, Madam Speaker. I would support the motion.
Any discussion to the motion? All those in favor of the motion, please say aye. Aye. Those opposed, please say no. The motion prevails. The clerk will give the bill its second reading.
Second reading, Senate File Number 3813.
Second reading. I recognize the member from Olmsted, Representative Liebling, to explain the bill.
Thank you, Madam Speaker and members. Well, members, today we have an opportunity to do something bipartisan, bicameral, that is very much needed by our state, and that is to have a really good response to the emerging COVID-19 pandemic, if that's what it turns out to be. I don't think I need to tell members or the public too much about this today because it's been all over the news. We know we've had 2 cases in Minnesota, and we are really very fortunate as a state, and actually it's not an accident, that we have a very good public health system in this state, an excellent Department of Health, and also a very good network of providers across the state. Really, we're really in a better situation than many states, and yet we haven't kept up with some of our preparedness as time has gone on, and we need to put some more funds in right now so that the Department of Health can really ramp up its preparedness and potentially its response. So the department gave us a quite detailed estimate of the monies that they're going to need to respond between now and next session, because none of us know whether this is going to be something that dies out right away or whether it's going to become more serious. We want to be prepared, and the last thing we would want is for the legislature to have to come back in a special session to appropriate funds if more funds were needed to deal with an outbreak. So the Senate passed earlier today Senate File 3813 that appropriates the request that the Department of Health had asked for, $20,889,000. I want to make sure members understand this isn't just we're appropriating a bunch of money. We have a public health contingency fund, and the fund, it's called the Public Health Response Contingency Account. It's section 144.4199, and it is there for exactly these kinds of reasons. It puts very good structure around what the money can be used for, and it requires the Department of Health to get authorization to use the funds. What the bill before you is doing is recognizing that we are in session and that there has been a lot of discussion about this. We're authorizing them to use the money to go ahead and deal with the response here. So I think I will stop there. We have an amendment, and maybe this would be an appropriate time to bring that up.
There's an amendment at the desk. The clerk will report the amendment.
Liebling, Winkler, and Dowd move to amend Senate File Number 3813 as follows. The amendment is coded RA20-007.
Representative Liebling, to your amendment.
Thank you. So there were some jokes that were going to be made about 007. I don't know if anyone wants to make them, but maybe a little levity when we're talking about such a serious topic would be appropriate. But This amendment represents an agreement that we've reached with the Senate. And the Senate had concerns. We had concerns about the way the Senate bill was passed because the money that's being appropriated, while it's going into the fund that I discussed that already has quite a few, has some structure about how it can be used, the language of the bill is very specific and appropriates the money only for the purpose of this virus and this disease. And so the Department of Health had some concerns about the restrictiveness of that language because already they have to come to the legislature or the LAC to get authority to use the money. So this is a compromise. The first part of the amendment allows the department to the money that has already been in the fund, the amount of money that's currently in the fund, to continue to allow them to use that under the same restrictions as previously. The second part of the amendment is language that has been discussed that is allows the department to use federal funds that may come in to also fight the epidemic without having to go through the normal process of having the legislature appropriate those funds specifically. So again, this is the idea here is that when we are not in session, if that is when our state experiences more of a problem, that these funds should be immediately available without delay to allow our very competent and thorough Department of Health to use these funds to fight the epidemic or the pandemic. So with that, Madam Speaker, I would just urge everyone to vote in support of the amendment, and I would be happy to take questions.
The member for Santee, Representative Dowd.
Thank you, Madam Speaker. Just as we were reading this, we caught a little typo on the amendment. So I'd like to offer an oral amendment to the amendment, and that oral amendment would be on line 1.7 of Amendment 007, that should read after line 19 instead of after line 18. So scratch 18 and insert 19. I'd offer that as an oral amendment.
Representative Liebling.
Thank you, Madam Speaker. I would accept that amendment.
All those in favor of the amendment to the amendment, please say aye. Aye. Those opposed, please say no. The motion prevails. Discussion to the amendment. Representative Dowd.
Thank you, Madam Speaker and members. I did participate in negotiating this with the Senate, and I do have commitment from the Senate Republicans that they're okay with this language and that they will accept it once it comes back over today. So I would encourage people to vote for the 007 amendment as amended.
Any further discussion to the amendment? Seeing none, all those in favor, please say aye. Aye. Those opposed, please say no. The motion prevails. There being no further amendments at the desk, the clerk will give the bill its third reading.
Third reading, Senate File Number 3813, as amended.
Third reading as amended. Discussion to the bill. Any discussion to the bill? The author of the bill, Representative Liebling.
Thank you, Madam Speaker. I just would like to conclude by thanking some folks. First of all, thank you, Representative Dowd, for your assistance in getting this. He was extremely helpful in getting us to an agreement here. I really appreciate that because this really is urgent. Members, we talk about urgency a lot around here, and it is really urgent that we prepare. I mean, Minnesota really has not so far seen what some other places have seen, but it is really important that we start to get resources in place so that we can avoid any of the worst consequences that may be coming otherwise. So this really is an urgent matter. I would like to really thank the Senate for their work and thank everyone who's worked so hard on this. Some of our staff were here a lot over the weekend. Staff from the Department of Health have worked extremely hard to get this to where it is. I also want to assure members that this is not all we're going to be doing. We have some other bills coming. There are obviously different facets of this that we will need to be addressing as time goes on here, but this is initial money to help with our state's response and to get some resources in place. I would like to thank my committee administrator, Patrick McQuillan, who has also put an extreme amount of time into this, and and to everyone who I've probably forgotten to name who's worked on this. I think we're showing the public that when needed, that we can pull together both bodies, both parties, and get the important stuff done. And I think that is a really important statement that we're making today. Thank you, Madam Speaker.
The clerk will take the roll on the bill. The clerk will close the roll. There being 133 ayes and 0 nays, the bill is passed as amended and its title agreed to.